I want to welcome Shira up to speak about lessons for practice. And in her practice, I know she is helping, as a psychologist, helping people with focusing on mental health and stress management and burnout, all very relevant topics for all of us. So please give a warm welcome to Dr. Shira Yufe.
Hi there. Good afternoon, everyone. Thank you for the introduction, Charles. Fun fact, Charles taught me how to drive. When I was 16 years old, he was the only one who was willing to take me on the main streets. Everyone only wanted to take me in parking lots, and I drove here today. So thank you, Charles, for teaching me how to drive. Does this go back and forth? Yeah.
Put it over here.
Okay.
It's not going up yet.
No.
Okay. Let's see. Maybe it's out of power.
It's on this screen.
Yeah, it's changing on here, but not on there. You got to get. I don't know the terms.
Fix it.
There we go.
No.
They're all working on it.
This is because you changed the order, just so you know.
Working on it.
Okay, well, I can introduce myself now while this happens. I'm Shira. I'm a clinical and health psychologist. I work at Laxman Dole Psychology in private practice in downtown Toronto. I received my training at the Princess Margaret Cancer Centre. They have a specific caregiver clinic there, and also at St. John's Rehabilitation Hospital at Sunnybrook. As well, my PhD research focused on the psychological support methods that would benefit young women with breast cancer. So that's how I came into being a health psychologist. So what it means to be a health psychologist is that we have an area of specialization helping individuals and their families and their caregivers with the psychological impacts of being diagnosed and living with illness. Okay. Thank you. Yes, thank you. Thanks, Jonathan. Yes, okay. So now we are ready to go. Okay, so in today's presentation, I'm going to talk to you about some of the work that I do on a daily basis. We're going to talk about the psychological impacts of being an informal caregiver. So that means friends and family, adult kids who are taking care of their aging or ill parents. It could mean a parent taking care of a acute or chronically ill child. It could be siblings taking care of siblings or friends and family. So essentially they are like our invisible healthcare workforce, not just our social workers, OTs, nurses, physicians, but the common folk who are taking on this healthcare role. So we'll talk about that and what they experience mentally in the caregiving role. We'll talk about the common psychological support methods that can be helpful for maintaining the mental health of an informal caregiver. And then we'll talk about strategies for remaining grounded as a caregiver. And in today's presentation, I'll use the term patient and care recipient interchangeably, and caregiver as someone's loved one or someone's spouse, for example. So what we know about informal caregivers is that they have a very wide range of experiences when they're caregiving. And I've called it from crisis to connection, because we know that, like what Dr. Nicole talked about, is that something like post-traumatic growth can occur within a caregiving experience. So caregivers do experience, or at risk of things like burnout. We often hear that among healthcare professionals, but so are the informal caregivers as well. They're at risk for developing depression and anxiety, even if they've never had that before in their life, just from being thrust into a caregiving role, fatigue, and burnout. Some really common reactions that we see from informal caregivers are fatigue, sadness, anticipatory grief and loss, unexpected reactions to the caregiving experience, and also having just a messier rhythm within their life. But also, we know that caregivers experience easy days, optimism, a sense of valued living. They recognize what's really important to them when they are caregiving for a loved one. So when in the process of putting together this presentation, I approached a friend of mine who is currently in the throes of caregiving. She is a pediatric nurse at Sick Kids in the cardiac unit, but she's also a caregiver to her daughter, who's 4.5 now, who's been fighting leukemia for 2 years. And so I asked her if she would be willing to share with us what it's like to be in this caregiving role as a mother, as a nurse, and taking care of her sick daughter. Actually, her daughter just got her bone marrow transplant a couple days ago. So I'm not going to read all of this out to you, but I'm going to just pick out some important pieces from her experience. So she says, I never could have imagined sitting in an ER getting a cancer diagnosis for my 2.5-year-old. Keep in mind, her daughter's now 4.5, so we're 2 years later now, still fighting through the leukemia. She said, in an instant, our worlds were turned upside down and my role as a mother and caregiver shifted. The same hands that wiped tears, played dolls, changed diapers, cooked dinner, and pushed a stroller now also drove back and forth to the hospital, gave chemo, and stroked my daughter's back as she sat in hospital rooms. While my world was closing in, the anxiety, fear, depression, and grief had set in. And then we'll skip down to the bottom there when she says that the truth is, it's impossibly hard, often crushing, and I wish life could be normal again. It's a lot to carry, not just the tasks, but more so the mental and emotional weight. She also says, it is my greatest calling and greatest honor in my life to be able to care for her. So that's my friend Michelle, who's very kind to share what it's like to be in the midst of this experience. Okay? So in my work, in private practice, sitting across the room from someone who's come in specifically because they're a caregiver, something that often comes up will be the pre-caregiving relationship. It always infiltrates into what's happening right now between the care recipient and the caregiver. So these are some prompts that I ask people to reflect on, whether that's alone or with me in the room together, so we can explore that. Other information that's relevant to working with caregivers is I want to know if they have a previous mental health diagnosis or concern, other life stressors, what is their general coping style, their personal strengths, and if they have a history of perfectionism. Sometimes the most competent individuals at caregiving are also the most overwhelmed ones. So we want to make sure that they're safely supported in their role as well. Okay, these are some of the assessment tools that I might use to help me in my work, but is also for the caregiver themselves to be able to track and understand what's going on for them. That first one there, the caregiver self-assessment questionnaire, that one is a specific measure of distress a caregiver might feel in response to their care recipient's behavioral symptoms. The caregiver burden inventory is a multidimensional tool, and it measures things like time dependence, physical burden, social and emotional burden of caregiving. And then finally, that last one, the KCSS, is one that helps me measure caregiver stress over time. So we can take a baseline, and then we can look to see if there are any changes in stress or no stress over time in the caregiving role. So there are different types of caregiving that people can deliver. One nice place to start is where your strengths lie. I really encourage people to lean into their strengths. So you may be someone who is very organized. You may be someone who's great at cooking. You may be someone who is a wonderful advocate and can talk to the care recipient's healthcare team. So oftentimes people are overwhelmed as a caregiver, but if you are leaning into what already is something you feel good and competent at, that is the place where you can start, and so that it doesn't all have to fall on you. Okay, so the different types of caregiving that we most commonly see are instrumental, informational, financial, and emotional. If you are a wonderful listener, an active listener, a non-judgmental listener, that is a wonderful way to support someone who's in need of it, and you don't need to be a professional to be able to do that. Okay, this is a nice model of how caregiver stress starts and is maintained over time. It's a theory here. It's the stress process model, which is a theoretical model we use for understanding how burnout even starts within someone. This is from a 2003 paper looking at stress in carers of those who have Alzheimer's disease. And I use this with trainees to help them understand. There's a bit of jargon in it, but this model does help us to understand, and it has stood the test of time from the year 2003. So I do like to bring it up just to show how someone's socioeconomic status, family network, and personal learning history does bear and have outcome effects on what the experience of caregiving will be like for them. Okay, so let's talk about the hallmarks of caregiver management. The approach that I like to work with clients is sustainability. We've heard from a few others today about the importance of having a sustainable approach to caregiving, because oftentimes caregiving is multifaceted, it's chronic, it's ongoing, and it can worsen. It's very much a dynamic thing. Okay, so we want to make sure that when we're caring for a caregiver, if you are a clinician caring for a caregiver, like a nurse or a physician, an OT, a PSW, these would be the hallmarks of caregiver management. Okay, so the first one there is community. What we mean by community is care coordination. Who are the major players involved? Who is providing respite? Informal or formal support networks. Okay. Knowledge. And so what we mean by this is psychoeducation. People come into me and I explain to them exactly what we've heard today, from crisis to connection. What is it that you can expect being a caregiver? Knowledge also means accruing skills of what are psychological support methods that can help you, and that will be very unique to each person. Empathy, this is the part about compassion. Compassion for self and for others is something that can be cultivated. It doesn't necessarily have to be this sort of natural, ever-flowing source that we all have. We can do things in our lives that will help us to cultivate compassion for self and for others. And finally, empowerment. We can get a sense of empowerment from community knowledge and empathy. But the important thing here is that we want to hit all four prongs. The research does show us that one of these alone won't be sufficient to be able to keep a caregiver's health and wellness at a solid state. So making sure that we have all four of these in place as best as we can will maximize the health outcomes for the caregiver, and in turn, hopefully the care recipient will benefit as well. Okay, these are two papers that I pulled because they are more recent. They're two systematic review papers about internet-based interventions for reducing caregiver stress. The evidence shows that singular supports are not as effective as multi-pronged approaches, but these two studies have shown that internet-based interventions for caregivers can reduce depression and stress, improve emotion regulation, and the caregiver's general quality of life. Caregivers are not studied as much as the patients themselves, but more and more we are getting more literature on how to support informal caregivers or our invisible workforce. Oh, and by the way, I did not mention how many invisible healthcare workers we have in Canada. We have estimates now that are approximate, but fairly good. It's believed that 3.8 million Canadians over the age of 45 are currently caring for a senior, and they are not a professional healthcare person. Okay? But the next generation of caregivers will be very digitally fluent. Perhaps they will be very well versed in AI. And so that's why most of what's coming out now academically is internet-based. And that's hopefully going to be supportive for the next generation of caregivers who are coming our way. And will hopefully be able to improve access to care if we can get them information and mental health support digitally, not just face-to-face. Okay, so I've pulled something from the palliative care nursing literature. It's a nice acronym that we could all use, and it's aptly called NURSE. And what this tool does is it gives us a framework and a formula for talking to the care recipient. Okay, so the acronym stands for name, understand, respect, support, and explore. When people come in to work with me, we practice this together because it's important to have the muscle memory for it when you actually go out there and you're talking to your care recipient. We never send players in to play a game without having them practice the skills before. And that's what we do in the room together, is we practice these communication skills so that when it comes time to have the real, true, and honest conversation with your loved one or your care recipient, you can use this as a tool for yourself to feel like you know what you're doing when you have that conversation. Okay. Bridging the communication gap between the caregiver and the patient or the care recipient. These are some questions or topics of conversation that have proven to be quite useful in enhancing the caregiver relationship. We have research that shows that when there is poor communication lines between patient and informal caregiver, just like if we had a healthcare professional who had poor communication with their patient, no one would feel great about it. And so this is why we have these set of tools to help us facilitate ongoing and honest conversation. And I'll always encourage people not to make any assumptions or misunderstandings about what their care recipient actually needs or wants from them, and to have this conversation often. It's not a one-time conversation because caregiving will change over time. It's a very dynamic process, and if we have these questions in mind, we can constantly be asking. For example, that one about energy levels, where are your levels at today, the types of activities they want to take on. And the last one there is, how are you able and willing to help as a caregiver? Okay, so that's something really important in what you're able as an informal caregiver to do. Okay. Self-compassion self-compassion focused therapy is very useful for caregivers to have. Once again, is a skill that can be cultivated. It doesn't mean that you're born with compassion or not. We can practice this, and it can be useful as a caregiver and for care recipients. So Dr. Kirsten Neff has an excellent audio specifically for caregivers. It's 6 minutes long. I've embedded it in this presentation. I was going to play a clip of it. Oh, there it is. Maybe I can play a clip of it. It's right there, the audio, and it's 6 minutes long. I'm not going to play it all, but essentially I have caregivers listen to this so that they can start to build compassion for self and others in their role.
Frustrated or tired or burnt out.
Oh, there she is.
Imagine that you are with the person you're caring for in your mind's eye.
Okay, so I'll pause it there, but if you want.
So imagine that.
Oops. Okay, that's a lovely audio that can be useful for healthcare providers as well, if you're professionally in a caregiving role or if you're an informal caregiver. And Dr. Paul Gilbert, he is the founder of Compassion Focused Therapy. He's a clinical psychologist in the United Kingdom. So there are some additional relevant tools that caregivers can benefit from. The acronyms that you see here are CBT, Cognitive Behavioral Therapy, ACT or ACT, Acceptance and Commitment Therapy, which is the third wave of CBT, and MBSR, which is Mindfulness-Based Stress Reduction. I'm not going to go through all the middle skills and strategies there, but the important thing is that we know that using these psychological tools can help caregivers with emotion regulation, increase their distress tolerance, have emotional intelligence, and also start to build some reality acceptance skills as well. Okay, so remaining steadfast. How does a caregiver stay solid in their role in a very difficult, sometimes draining, sometimes complex situation? So if there's two things that I could impart on you today and nothing more, it would just be these two things. So the first is that the way in which you as an informal caregiver experience it does make sense if you consider your personal learning history, what it means to be a caregiver, and the situation. The other thing is that caregiving is neither intuitive nor easy. Sometimes people feel a little bit fooled if you are someone's child and your parent has been raising you for years, and all of a sudden you are a caregiver, but you don't really know how to do it. And so the fact that caregiving, no one's really trained in it, it's not expected that you would necessarily know. Just like if you're someone's parent, it may not be as intuitive as you think it is to be someone's mom or dad. So there is a learning curve. There's trial and error, and we want people to have that normalized for them as they're going through their own caregiving experience. So that's what we mean when we say that caregiving isn't necessarily intuitive nor easy. And finally, remaining grounded. Using the combination of approaches is better than just the one. It should be multidimensional to help the caregiver with the practical, the logistical, emotional, and relational demands of being an informal caregiver. And the final thing is that we want to help caregivers avoid the trap of throwing themselves into caregiving or almost over-identifying with the role to keep the approach of sustainability. Research does show that the risk of burnout can be high among informal caregivers, so we want to make sure that their health and wellness is also prioritized. Okay. Thank you. That's it for today.